cervical extension or cervical retraction. And so you have the patient sit down and make sure that their scapulas are clearing the back of the chair. So that's fine for me, but for a shorter patient, you might need to give them a booster chair. So their arms need to be back and relaxed, and you can tell because if you have forward shoulders, the difference in retraction is quite huge between trying to retract with forward shoulders and trying to retract with shoulders pulled back. The neck can only go back as far as the shoulders allow. So it's important to get the shoulders down and back and relax. Just relax the forearms. Make sure they're kind of resting on the armrest so they're not elevating their shoulders either and overactivating the upper trap, which is a common problem. So we're gonna start with just a simple retraction, and it's gonna be like you're making a double chin, or an ugly dog is trying to lick your face. You're pulling away. And then you can also give overpressure with this as well. So some people can only get back so far, so they can kind of, as long as they're keeping the shoulders back, give a little overpressure. So they'll close their mouth, push back. And depending on where the dysfunction is, so if they have numbness and tingling mainly in the hand, then they want to kind of target the lower cervical spine. So they might need to do slight extension with the retraction. That should target more of this area. And if you want to see if the patient's doing it correctly, you can palpate C7, and if they're doing an appropriate retraction, C7 should vanish. It should become flush with T1 and C6. So that's a good way to check to see if they're retracting appropriately. And then if it's more of an upper cervical issue, they can kind of do like a little chin tuck and then retract a little bit. So you got slight flexion and then retract. You just kind of vary on the patient. Based on, it's all on symptom reduction. As long as they're feeling their symptoms are calming down or the pain centralizing, then they're doing it correctly.